Eye infections can pose a serious threat to children and may even result in irreversible vision loss. It's crucial to seek prompt and effective treatment, particularly when the eye or surrounding areas get invaded by bacteria, viruses, or fungi. Viral and bacterial conjunctivitis are the most common types of eye infections that affect children, and both are highly contagious. In fact, up to 1 in every 8 children gets an eye infection every year. Signs of an eye infection that require urgent medical attention. If you notice any of the following symptoms in your child, it's essential to seek immediate medical care to avoid complications. Swollen or red eyelids, moderate eye pain, blurred vision, fever above 104 degrees Fahr, altered behavior or general malaise. Trachoma is the leading infectious cause of blindness globally. It is caused by a bacterium called Chlamydia trachomatis. Transmission of the infection occurs through direct or indirect contact with eye and nose secretions from infected individuals, specifically young children who are the primary reservoir of the disease. The disease can be transferred through the aid of certain fly species. In areas where trachoma is widespread, preschool-aged children are often affected, with a high prevalence rate. The infection spreads in close quarters and is mainly transmitted by family members. Although the immune system can clear the infection, reinfection is common in endemic communities. Frequent infections can lead to trachoma, which causes the inside of the eyelid to scar severely, known as trachomatis conjunctival scarring. This can cause the eyelashes to turn inward and rub against the eyeball, trachomatis tracheasis, resulting in constant pain and intolerance to light. This condition can also cause changes to the eye that lead to corneal scarring, resulting in irreversible opacities, visual impairment, or blindness if left untreated. Herpes simplex virus type 1. Herpes simplex virus type 1, HSV1, is a common cause of eye disease, with herpes simplex keratitis being the leading cause of infectious blindness in developed countries. It is important to note that although HSV1 uses serous infections, it can cause minor eye infections, such as infection of the eyelids, conjunctiva, and corneal epithelium, which usually resolve on their own. On the other hand, newborn herpes simplex infection, usually caused by HSV2, can cause vesicular blepharitis and conjunctivitis, as well as permanent visual damage due to keratitis, chorioretinitis, optic neuritis, and encephalitis of the visual cortex. HSV keratitis can be identified through a range of symptoms which include eye pain, eye redness, blurred vision, sensitivity to light, watery discharge. The impact of HSV keratitis on children's vision. HSV keratitis is a condition that affects children differently than adults. According to the American Academy of Ophthalmology, children with HSV keratitis tend to have more severe cases, higher recurrence rates, and more secondary corneal scarring and astigmatism. This increases the likelihood of vision loss as compared to adults with the condition. HSV keratitis can recur, and the recurrence rates vary for different age ranges. Recent studies suggest that adults have a 32% recurrence rate for all forms of HSV keratitis. Children, on the other hand, experience a wider range of rates, spanning from 33% to 80%. For all pediatric cases, the cumulative recurrence rate was found to be 51%. Another cause of serious eye infections is the varicella zoster virus, which causes chickenpox and shingles. It is important to note that varicella zoster belongs to the herpes family. The viruses in this family have a tendency to lie dormant. When conditions permit, they reactivate. While keratovitis is a rare occurrence during primary infection, chickenpox, the reactivation of the virus in the fifth cranial nerve can lead to vision-threatening keratitis, uveitis, and retinal necrosis, visual impairment caused by zoster ophthalmicus. The development of a zoster rash can result in optic neuritis and cranial nerve paresis. A sectoral iris atrophy often indicates zoster ophthalmicus. Severe post-infectious corneal anesthesia and secondary sterile corneal ulceration can occur. As a result of this condition, chronic scleritis, keratitis, uveitis, and glaucoma can occur, potentially leading to limited visual acuity. Cytomegalovirus, CMV infection, and its effects on vision. CMV is a viral infection that can lead to infectious retinitis, particularly in patients with compromised immune systems and CD4 plus T cell counts below 50 cells. Although it's not the most prevalent eye-related complication associated with AIDS, CMV retinitis is the top reason why AIDS patients go blind. On the other hand, when an otherwise healthy fetus acquires congenital cytomegalovirus infection, it can result in varying degrees of retinochoroiditis. However, this condition does not progressively worsen after birth. Ophthalmia neonatorum. Ophthalmia neonatorum is an eye infection that can be caused by either gonococcal or chlamydial infection. Symptoms of gonococcal infection typically appear within 2 to 5 days of delivery, while chlamydial infection symptoms present themselves within 5 to 14 days. The symptoms for both types of infection are similar, including intense papillary conjunctivitis, bilateral edema, chemosis, and mucopurulent discharge. Gonococcal conjunctivitis is caused by Neisseria gonorrhea, which also causes gonorrhea, a sexually transmitted disease. A woman with untreated gonorrhea can pass the bacteria to her baby during childbirth. Newborns diagnosed with conjunctivitis commonly present with red eyes, thick pus in the eyes, and eyelid swelling. This condition usually develops within 2 to 5 days of life and can lead to severe infections such as bacteremia and meningitis. Staphylococcal eye infections. Staphylococcal eye infections in children can lead to a variety of infections, which include blepharitis, inflammation of the eyelids, conjunctivitis, infection of the conjunctiva, keratitis, infection of the cornea, dacryocystitis, infection of the tear ducts, orbital cellulitis, infection of the tissues around the eye. Thank you for listening. Don't forget to like and subscribe if you enjoyed the video.